Good morning, everyone, and thank you guys for coming to today's program titled Shining Moments. My name is Jennifer Hubbard, and I'm speaking on behalf of Marinus Pharmaceuticals, company dedicated to the development of innovative therapeutics to treat seizure disorders. I am an acute care pediatric nurse practitioner at Nemours Children's Hospital. I specialize in the neurology department and have my own CDKL patients. So before we get started, today's program is sponsored by Marinus Pharmaceuticals. I am being paid by Marinus Pharmaceuticals to come talk. The presentation, however, provides an overview of Ztalmy, and it's intended for caregivers of loved ones living with CDKL5 deficiency disorder for 2 years of age and older. The information is for educational purposes only. Obviously, we're not going to provide or suggest treatment, diagnosis, or medical advice. And we'd love for you to contact your healthcare provider for more information about CDD and to see if Ztalmy is right for you or for your loved one. And please refer to the accompanying Ztalmy medication guide for instructions for use. So in today's presentation, we plan to cover the following topics. We're going to briefly review CDD, including some of the common symptoms and information related to the diagnosis. We're going to discuss the seizures in CDD as well as their management. We're going to talk about Ztalmy and how it is used to treat seizures associated with CDD in patients that are age 2 years of age and older. And then we're going to discuss the resources and support that's available for the CDD community. So let's go ahead and get started. So first, we're going to cover an overview of CDD as it relates to the diagnostic process and the symptoms associated with the disorder. We know that some of you here today may have varied levels of experience with CDD. Some of you may have children that have been diagnosed recently, or others may have years of experience. So because of that, in this section of the presentation, we basically hope to give you an overview of what CDD is and the root of the disorder, acknowledge how symptoms impact people living with CDD, and families differently, while also covering some of the more complex topics associated with this disorder. Many caregivers use the term CDKL5 to speak about their loved one's condition, but that actually refers to the gene that we will talk about more in a moment. The disorder name is CDKL5 deficiency disorder, or CDD, and so for this presentation, we're going to use the acronym CDD. So to start off, though, let's talk about the basics of the CDKL5 gene. CDKL5 is a gene associated with CDD, and it's the cyclin-dependent kinase like 5. This gene provides instructions to make a protein that helps our brain cells or neurons to develop properly and to form the right connections. The gene is located on the X chromosome, which implies differences in who and how this disorder presents. Because females have 2 X chromosomes, CDD affects females 4 times more frequently than males. When the gene is mutated in males who only have 1 X chromosome, the disease can tend to be more severe because they don't have the possibility of that extra normal CDKL5 gene on another X chromosome. This gene mutation does not occur frequently, so CDD is considered an ultra-rare disease, affecting only 1 in around 40,000 live births. And it's unknown why the change in this gene randomly occurs. We don't know fully the cause of CDD at this time, but mutations of this gene have also been found in children diagnosed with infantile spasms, West syndrome, Lennox-Gastaut or LGS, Rett syndrome, cerebral palsy, and intractable epilepsy of other origins. While every experience is different, patients with CDD do tend to share a few fundamental characteristics. The hallmark symptom of CDD, and usually the first symptom to emerge within weeks or months of birth, is seizures. These can occur daily in most people with CDD and are often very severe. In addition to seizures, cognitive and developmental delays, low muscle tone are usually identified in suspected people with CDD. CDD is confirmed with a genetic test, which looks for the presence of the CDKL5 mutation. This test is a blood test ordered by a doctor and sent to a lab where genetic sequencing is performed. As we mentioned before, the symptoms of CDD can look different for each person based on the severity of the CDKL5 gene mutation. So everyone's experiences and challenges are going to be different. In addition to the seizures, cognitive delays, low muscle tone, other symptoms that commonly occur are problems with sleep, GI issues, movement disorders, and speech problems, among others. Visual problems are also considered a differentiating symptom for CDD from other forms of epilepsy that we've previously mentioned. Cortical visual impairment, or CVI, relates to lack of eye contact and is a brain-based disorder of vision that is observed in 70 to 100% of the patients with CDD. Having such a large and broad constellation of symptoms usually requires treatment by a team of different healthcare specialists. These providers include neurologists, endocrinologists, optometrists, speech therapists, dietitians, occupational therapists, gastroenterologists, sleep specialists, and an epileptologist, among others. Balancing the management of this disease, along with all the appointments and therapy sessions that are needed to provide holistic care to our patients, can be very challenging, especially on the days when just managing the seizures are very difficult. Building on the notion that seizures are a major part of caring for someone with CDD, management for these seizures remains a difficult task. To understand the seizures and CDD, let's dig into why they occur in the first place and how they can be treated. You can see on this slide, it's one of our patients, Gigi, who has CDD and is taking Ztalmy, one of our great care families. So to start, it's important to note that not all seizures look the same. Seizures in CDD are variable and include an entire spectrum of seizures. Some of these are very visually obvious and are big movements, and so others are so subtle that we may not even realize that they're happening. It's not understood why the seizures can present differently in people that have the same genetic CDKL5 mutation, or why different types of seizures occur within the same person, but we do know that they're disruptive to their daily life. On the right side of the slide, you can see the most common types of seizures in people living with CDD. The larger the bubble, the more often they occur. Epileptic spasms, often called infantile spasms, are brief flexions or extensions of the arm, leg, or head muscles. Tonic spasms are brief extensions or tension or stiffness in strained position. And then we have the hypertonic seizures that have multiple phases, including hypermotor tonic and spasm phases. Each of these phases can last between several seconds and several minutes. And then we know the generalized tonic-clonic seizures are characterized by loss of consciousness and are followed by stiffening and jerking of the muscles. Myoclonic seizures are brief shock-like myoclonic muscle jerks. Again, not all seizure types occur in each person with CDD, and the type of seizure experience can change over time. For example, epileptic spasms, they often outgrow them once they get out of that infantile period. So your brain is made up of thousands of cells called neurons, and these are responsible for sending and receiving information, including excitatory and inhibitory signals in the brain. The information travels across the brain via connections between the neurons, which you can see in the slide. CDKL5 provides instructions for a protein that is vital to forming these connections during development, and a mutation in this gene can lead to problems with the neuron's ability to communicate with each other. Again, the exact cause of seizures in CDD, like in other epilepsies, is not fully known, and it is believed that they may result from an imbalance in those excitatory and inhibitory signals in the brain. Here we're going to zoom a little further into the connections between the neurons. So the way normal connections happen at each of these levels is through chemicals called neurotransmitters. One that may sound familiar is called GABA aminobutyric acid, or GABA. GABA is the main chemical responsible for inhibiting the neuron's activity, signaling it for it to quiet or slow down. And it does this by attaching to certain GABA receptors found on the neurons. When these inhibitory signals don't work, these neurons actually become overexcited, which leads to seizures. Seizure management is a super important aspect of daily life with CDD. While seizures may not be the biggest concern or may be fairly well controlled, seizures occurring can take time away and energy away to focus on these other things. On bad days, things may often feel out of balance. There's a constant give and take related to attending therapies, appointments, playtime, focusing on milestones, time with family, seeing specialists, managing seizures, focusing on your own career and your own relationships, among other things. And you can tell that by the slide that it's often very one-sided when seizures are out of control. Seizure management may lead to more good days. So a good day typically means caring for the aspects of somebody living with CD. They're in balance. Whatever the buckets look like for each of you individually, improvement in seizure management makes room for more of the good days, doing the things that you loved with your loved ones. There is a therapy that is approved specifically for the seizures associated with CDD that may be worth considering throughout your loved one's treatment journey. That product is Ztalmy, or ganaxolone. It's the first and only FDA-approved prescription medication specifically for seizures associated in CDD with patients 2 and older. In this section, we're going to discuss how Ztalmy works related to CDD. We're going to dive into the clinical trial that served as the basis for approval, and we're going to review Ztalmy's safety, efficacy, and learn how it is given. So before we get into some more information, I'd like to cover its indication. So what is Ztalmy? Ztalmy is a prescription medication that is used to treat seizures associated with cyclin-dependent kinase-like 5, CDKL5 deficiency disorder, CDD, in patients 2 years of age and older. Ztalmy is a federally controlled substance because it contains ganaxolone that can be abused and can lead to dependence. We need to keep Ztalmy in a safe place to prevent misuse or abuse. Selling Ztalmy or giving away Ztalmy may harm others and is against the law. So tell your healthcare provider if your patient has ever been abused or been dependent on alcohol, prescription medication, or street drugs. And it is not known if Ztalmy is safe and effective in children that are under 2 years of age. So what is the most important information that I should know about Ztalmy? That Ztalmy can cause serious side effects, including sleepiness. Ztalmy may cause sleepiness. Taking Ztalmy with other central nervous system depressants, including alcohol, may increase this sleepiness. And you should know how Ztalmy affects your patient before doing activities that will require alertness. In CDD, neurons may become overexcited, resulting in seizures. As a quick refresher, we talked earlier about how GABA regulates brain activity by attaching to certain GABA receptors found on neurons. Depending on their location, some of these receptors produce short bursts of inhibition, while others produce steady currents of inhibition. Exactly how Ztalmy works to treat seizures in CDD is not fully understood, but it is thought to reduce the seizures by enhancing the inhibitory activity of GABA in the brain. Ztalmy is a different kind of seizure medicine that enhances both types of inhibition by working on the GABA receptors on different locations on the neuron. This dual approach to inhibition may help to calm overexcited neurons, potentially resulting in fewer seizures. Ztalmy binds to a part of the receptor that is distinct from the other treatments like benzodiazepines or benzos. Ztalmy may cause suicidal thoughts or actions. Please pay close attention to changes, especially sudden changes in mood, behaviors, thoughts, feelings, and keep all your follow-up visits with your healthcare providers as scheduled. To determine its efficacy, Ztalmy was evaluated in a phase 3 clinical trial that lasted 17 weeks and featured 101 participants living with CDD, ranging from ages 2 to 19. Screening for the trial began in June 18 and ended in July of 2020, 2 years before Ztalmy was approved in 2022. The trial was double-blinded, meaning that neither the participants nor the treating physician knew what treatment the participant was on during the study. They were randomly split into 2 groups. the Ztalmy group, which had 50 children and young adults, and the placebo group, which had 51. The primary endpoint of the study, or the major outcome being evaluated, was a change in major monthly motor seizures. Please do not stop taking Ztalmy without first talking to your healthcare provider. Stopping Ztalmy suddenly can cause the patient to have seizures more often or seizures that don't stop, status epilepticus. And we talked about the major motor seizures, including both bilateral tonic, generalized tonic-clonic, bilateral clonic, atonic drop, or focal to bilateral tonic-clonic seizures. Trial participants were highly refractory, and they had tried and failed many anti-seizure medications and continued to have severe and frequent seizures. On average, trial participants were 6 years old and were mostly female. They had tried and failed an average of 7 anti-seizure medicines prior to the trial and were still taking roughly 2 anti-seizure medications alongside Ztalmy during the trial. 96% of the participants were taking other seizure medications during the trial, the most common ones including valproate, Keppra, clobazam, and vigabatrin. Prior to the study, participants had a range of 19 to 147 major motor seizures per month. It's important to tell your healthcare provider about all the medicines that the patient is taking, including prescription and especially over-the-counter medications, vitamins, and herbal supplements. Ztalmy can affect the way that other medications work, and other medications may affect the way Ztalmy works. Again, please do not let the patient stop or start taking other medicines without talking to your healthcare provider, especially letting the provider know if your patient takes alcohol, opioids, or antidepressants. Know the medicines that your patient is taking. Keep a list of them to show the healthcare provider or the pharmacist when the patient gets a new medicine. The goal of the trial was to determine how Ztalmy changed the number of seizures per month for people that are living with CDD compared to the placebo. Participants taking Ztalmy had a 31% median reduction in monthly seizure frequency compared to just 7% in the placebo group. That means that the participants in the Ztalmy trial experienced a reduction in seizure frequency more than 4 times greater than those of the participants taking the placebo. Additionally, 1 in 4 participants taking Ztalmy had at least a 50% reduction in monthly seizure frequency compared to 1 in 10 taking placebo. 1 in 10 participants taking Ztalmy had a 75% or greater reduction in monthly seizure frequency compared to 1 in 25 taking the placebo. 31% major monthly reduction in seizures, a third less. Overall, the most common side effects of Ztalmy included sleepiness, fever, excessive saliva, or drooling, and a seasonal allergy. Sleepiness was experienced by 38% of the trial participants taking Ztalmy versus 20% taking the placebo. 18% of participants taking Ztalmy experienced fever compared to 8% taking placebo. 6% of the patients taking Ztalmy experienced salivation or drooling compared to 2% with placebo. And then 6% of participants taking Ztalmy experienced seasonal allergies, which did not occur at all in the placebo group. Of the 22% of Ztalmy treating participants who had dosing interrupted or reduced because of adverse reactions, 10% were due to somnolence and 2% were due to sedation, which both appeared early during treatment and were generally dose-related. 2 patients in the trial taking Ztalmy discontinued, 1 due to sleepiness and seizure and 1 due to seizure. So obviously when starting Ztalmy, it's important to work with your loved one's doctor to increase the dose based on tolerability, no more frequently than every 7 days. And please talk to your doctor and your loved one's doctor if they experience sleepiness during the early period when increasing the dose, and we can help adjust the dose. These are not all the possible side effects of Ztalmy, so you need to talk to your healthcare provider about any side effect that bothers you or your child or that does not go away. And always call your doctor for medical advice about side effects. Ztalmy is formulated with the needs of your loved one in mind. Zatomi is cherry flavored. It is sugar-free and suitable for ketogenic diets. It does not require refrigeration, so it is very convenient to store, carry with you. It's approved for people living with CDD that are 2 years of age or older, and is administered as a liquid medication. Dosing is 3 times a day with food. One of the things that I love about the patients that are on the ketogenic diet is how it helps with the absorption. So once again, it's suitable for a ketogenic diet. When starting Zatomi, your healthcare provider may titrate your loved one to a specific dose, increasing the dose over time. Your physician will decide on the titration and maintenance dose and may discuss with you how you or your loved one is tolerating the medicine, if they have any side effects, and if any dose adjustments are needed. For more information about Zatomi, you should read the medication guide and instructions that accompany your prescription. Please do not let the patient drive or operate heavy machinery or do other dangerous activities unless you know how Zatomi affects them. Zatomi may, again, cause the patient to feel sleepy. So once again, 3 times a day it's administered with food, and then titration is weekly as the patient tolerates it. So there's some important additional safety information related to Zatomi that I'd like to cover before we move on. So what should I tell my healthcare provider about all the patient's medical conditions, including if they drink alcohol, have or have had depression, mood problems, or suicidal thoughts or behavior, have abused or have been dependent on prescription drugs, prescription medications, street drugs, or alcohol, have liver problems, are pregnant or plan to become pregnant. Tell your healthcare provider right away if your patient becomes pregnant while on Zatomi. You and your healthcare provider will decide if the patient should take Zatomi while they're pregnant. If they're breastfeeding or plan to breastfeed, as Zatomi may pass into breast milk. So talk to the healthcare provider about the best way to feed the patient's baby while taking Zatomi. Resources and support. Before I wrap up today, I want to leave you with a few things. While the information we covered today in the CDD journey may often feel overwhelming at times, resources and support are available. First, and specific to Zatomi, Marinus offers Zatomi One, a comprehensive support service program built to help you navigate with the treatment guide, with the treatment journey with Zatomi. Getting started with any new treatment can feel like a lot, and this program is designed to connect you directly with the specialty pharmacy that provides Zatomi. Specialty pharmacies focus on rare, complex conditions and have special training and resources to appropriately provide medications like Zatomi. Zatomi One will assist, and I can speak to this personally, with access and coverage, timely prescription delivery right to your door, and keeping all information up to date. The care coordinators work amazingly directly with the doctor's office and with the insurance companies provided to assist with all insurance approval processes. They are phenomenal at keeping you updated through the process and support if prior authorizations are needed. While the care coordinators do not provide medical advice or individual patient care. So once again, for medical questions, please be sure to contact your healthcare provider. The Zatomi One is available on weekdays via phone, and pharmacists are available 24/7. Additionally, there are educational and informational resources available through Zatomi.com. Some of these will also be included in the product shipments. These include brochures and guides, such as a downloadable doctor discussion guide that provides suggestions of some of the important topics and questions that you should ask your healthcare provider about the seizures associated with CDD. A caregiver brochure that provides useful information about Zatomi. A printable treatment tracker worksheet to help you keep track of your child's treatment, and a pamphlet that equips caregivers with everything they need to know when getting started with Zatomi, and a guide that explains how to give Zatomi. In addition to the resources that are found on the Zatomi website, there are many other groups that offer CDD-related support, educational information and events, and helpful tools for caregivers and people living with CDD, including those listed here. We've covered quite a bit of information in this presentation, so just to recap a few important points. CDKL5 deficiency disorder, or CDD, is an ultra-rare disease that can be diagnosed with a genetic test. Seizures in CDD are an important symptom, but this particular symptom is very difficult to manage. Ztalmy is the first and only FDA-approved prescription medication for seizures associated with CDD for ages 2 and up, and was associated with a 4 times greater median monthly reduction in seizure frequency compared to the participants who received a placebo in the clinical trial. Common side effects reported in the clinical trial include sleepiness, fever, drooling, and seasonal allergy. I hope I've provided you guys with some important information and helpful information to help you walk away from today, to help you guys feel like you know a little bit more about CDD. If you think that Ztalmy might be right for you or your loved one living with CDD, I encourage you to talk to your doctor. You can use the QR code that's on the screen behind me to download the doctor discussion guide and other resources on Ztalmy.com, which might assist you in this conversation. There is a Marinus booth located in the exhibit hall today, which will also help with talking to your doctor about these questions. And I want to thank everybody for being here today, and I hope you guys enjoy the rest of the conference. Thank you.